Yeah, you have another one. So yours is a classical deviated nose, severely deviated. Just clinically we know that the nose is deviated a lot. There's the midline and the shape it a bit. We need to see your scans also. Let's just quickly go and check your scan. So have you had any procedures regarding this in your life thus far? Nothing. Nothing even from inside the nose years before. No one has touched it. And breathing difficulty is there, I know. But is it very severe that affects your normal life? Or happens once in a while when you have cold?
No, so it's more like when I play some games which are which requires a lot of cardiovascular activity. That time actually I face issues. So just to give you some understanding, like if I am riding cycle, I won't feel anything. I can ride for hours, no issues. But if I am playing football and like I am doing sprints, so that time I will. And it's relative, like compared to people who are playing with me, I feel like I get tired also.
Now, there is an issue in your nose, inside as well, on the septum. There's a nice deviation which is actually causing obstruction, okay? But I'm not so certain if that is going to improve your stamina, because what you're saying is also related to stamina. Clear airway is not directly translated to good stamina. Stamina comes with regular practice and multiple other issues. But breathing, you definitely have a problem, which I will address in solid talk. And of course the shape as well. So, I mean...
So, like, what issue do you see? Like,
clear breath, you see?
So, I am breathing only through one nose problem, right?
Most likely it's like that, yeah. There's a clear deviation.
So, why I am saying like it could be due to the nose? Because like if I am riding cycles and all, like last Saturday only I ride cycle for 2 hours.
And the reason why I have said is, let's say 6 months after rhinoplasty and septoplasty and septal reconstruction and everything, you go back to playing football and you still feel tired.
Yeah.
It doesn't mean that the surgery is a failure.
No.
That's the idea I'm giving you. There is a good chance that your complaint will settle down, but with relation to stamina, this surgery is not for that. There is a relation when you're not able to breathe well, so then, you know, the body oxygenation comes down and your stamina level is related. I'm not saying it's not related, but if you were to come back and tell me 6 months later, doctor, nose is looking good, I'm able to breathe well, which are the two main concerns of our procedure, right? The third thing is something that I think will get improved in your case, but I can't assure you as a, like, pakka ho jayega.
No, that's all.
This is the thing you have to understand, that's all. Because it's thoda indirectly related, not exactly directly related. That's why. Otherwise, other two things are direct relation, that will sort out. So, we don't need anything else. Now, I want to know when you want to get it done. So, accordingly, we can do your blood test and we can tell you how many days to stay and this and that.
So, actually, I was expecting to get done today, but
tomorrow is possible.
Yeah, so tomorrow.
Today was like a little. And another thing is, you know, when you have a condition like this, I might also need to harvest rib just in case. I'm thinking there's a 50-60% chance that I need to harvest rib, simply because the nose is so deviated, and the deviated septum that also plays a part in the support of the tip and the whole nose. It's not doing its job well. So I need to put in some other cartilage that's going to support it, basically. That's the reason I might need rib. However, in some patients, they're able to manage that without actually going to the rib by moving the cartilage itself to a more better location, so to say, that gives more support in the stress area, thereby lifting the nose up. So if I'm able to manage that, then I'm not going to venture and take your rib. But for some reason, if that's not possible, then we have to bank on your rib. So that's why I put plus or minus rib harvest. And in case I do, just going to be from the right side, it's not going to affect the length of your stay here, but it sometimes affects your overall recovery period by an extra 1 or 2 weeks, because that we put in also must heal.
And like what will happen here?
That will heal up. There's going to be a small scar that's visible, very faint one, about inch or an inch and a quarter in length, about 2.5 centimeters max.
Okay.
Yeah, it's going to heal up.
And like what exactly are you going to do with my nose?
The full thing we have to do. I've written a septoplasty, rhinoplasty, reconstruction if needed, meaning so we'll have to fracture these bones. I'll have to fracture the bones inside the septum, remove the bent part out, and then go about reconstructing the entire nose from the radix to the tip. So we basically, your nose is going to move to the midline. One bone is longer than the other right now. That length will be same by fracturing it. Then there's going to be issue done with your breathing, both at the external level and also the internal level. And finally, a little bit tucking in.
Okay. And I assume the recovery time will be higher than usual, right?
So 1 week here and 4 weeks in all is what I will tell you. You should settle this time.
So I am planning to work from bed next week.
You can work from there for morning. Not a problem.
And what about the recommendation?
I can give you.
Okay.
If they're not able to arrange from today, they will fail to arrange it from tomorrow. That's not going to be a problem. And if Wi-Fi is quite good, you can work. Diet will not be there for you. You'll be able to eat any diet, normal diet.
Okay.
So no dietary restriction. You'll feel fine and fit. Some patients can get back to working even after 12 hours, but I think 24 hours is a reasonable time to wait for. Alright? Chalo then. Get the things done. They're going to quickly run the blood test. I think it's not been done yet, right? So we run your bloods. If you have your RT-PCR vaccination details, please hand them over to them just for records. And we'll give you an appointment for tomorrow morning. And you can head out and come back by about 8:39 tomorrow morning. I will try and finish it by noon tomorrow.
Do I have to follow like what I'm supposed to eat?
Now?
For dinner?
Anything you choose. There's no restriction.
Then for breakfast also?
No, you're not supposed to have breakfast. So you'll come fasting. Okay? Alright, see you tomorrow. And this is your copy, so you can hold this with you. You can let Nalik know.